How can we improve acute care for people with dementia? Hi, I'm Katie Featherstone. I'm Professor of Sociology and Medicine.
I'm Dr. Andy Northcott. I'm a Senior Lecturer in Sociology of Medicine at the Geller Institute of Ageing and Memory.
Hospitals have a huge population of people who are living with dementia. They're one of the largest groups in our hospitals. Although they're a really large population, they have some of the worst outcomes.
Acute care settings are problematic for people with dementia for two reasons. They're designed for a young patient who's going to walk in, get bandaged up and go home again. And secondly, because they're very disorientating and alarming. And if you don't know where you are, or you've forgotten where you are, or you didn't know where you were when you came in, it can be incredibly frightening, scary, or make you very agitated. Across that period since 2015, we've done just over a full year of observations. And that's just been going onto a ward and standing for between 4 and 12 hours with a notebook and a pen and observing what's happening, talking to nurses as they deliver care, doctors as they make decisions, to patients as they sit at their bedside, families as they sit with patients.
One of our main findings is around the way care is organised and delivered is very rigid, it's very fast-paced, and we can see the consequences of that on patients but also on staff. When we've observed staff giving amazing care that's very emotionally driven and listening to the person, spending time with them, we've often seen it being stopped.
And these little interactions can be hugely important and significant for someone, but nurses and staff just don't feel they have the time because it's not what the hospital wants them to do. I think one of the solutions is to change systems that enables them to talk to patients, to hold their hands, to make them feel safe, and not feel that they should be running off to perform another task or going to see another patient.
This is something I think we've always wanted to do, is to write a bigger story of the research. We wrote this in lockdown, and I think it was in some ways a scary process to put that story out there, but we've had amazing feedback.
One of the good bits about our evidence is that people want to hear it and want to make a change.
And for us, I think, to find that older people live with dementia, nurses, healthcare assistants, gerontologists, consultants, and other academics all recognise what we've written. And for us, I think that's really, really important, that they recognise the story of the wards that we're exploring in the book.
People living with dementia belong on these wards, and we need to be able to transform these wards so they belong to people living with dementia.